I'm pleased to be joined today by Professor William Sandborn from the University of California, San Diego at UEG Week 2019 in Barcelona. Thanks for meeting with me.
My pleasure.
I just wanted to start out and ask if you could maybe enlighten how IBD affects a patient's quality of life.
Well, IBD, both ulcerative colitis and Crohn's disease, really have a remarkable impact on patients' life. Patients will often have symptoms of abdominal pain, diarrhea, rectal bleeding. They can lose weight. Many of the patients, especially with Crohn's disease, end up going to surgical resections. The disease often comes back afterwards. And the medicines that they are required to take for this have a lot of potential side effects, and this ends up being a chronic illness in young people that just profoundly affects their quality of life.
And could you explain to us a little bit what the current standard of care is?
Well, the current standard of care for ulcerative colitis, some patients take mesalamine, but in at least half of patients it doesn't really work. And then for both conditions, it's steroids, which have a lot of side effects, including infection and many other complications, immune suppressive agents like azathioprine, anti-TNF antibodies, which have an increased risk of infection and lymphoma or malignancy. We have some other newer medicines, but often these medicines don't put patients into remission or don't maintain their remission for a long time. So the patients are really forced into these medications, which have a lot of side effects, and in many cases have to be given intravenously or as a regular injection.
Okay. And how could ABX 464 address potentially these limitations or these negative side effects that you've mentioned in the current standard of care?
Well, ABX 464 is a very interesting molecule. It's oral. So far, it seems to not have important side effects. Of course, we need more information, but so far it looks good. And we saw very interesting results in the initial preliminary study with respect to achieving response and remission in patients with ulcerative colitis. So an oral medicine with a good safety profile and a good remission rate, I think, is very interesting for patients, and it seems to be a very promising potential future option.
Okay. So do you think that ABX 464 could be a unique treatment option?
Yes, I think, again, we have to do some more study, but so far the profile looks interesting because of the oral nature of the medication, the favorable safety profile, and the very good remission rate that we see in the early study. And we need to see if how this plays out with the large trials, but I think it could be a very interesting future treatment option.
Okay. Anything else you'd like to add?
No, I think we're all excited to test it in the next phases and test it in Crohn's disease and see where it will go.
All right. Well, thank you so much for joining me for UEG Week 2019 in Barcelona. Thanks, Professor Sandborn.